Clive, the Director of Clinks, the voluntary sector umbrella body for organisations working in criminal justice. The advantages are that there will be a much more diverse range of providers that could lead to more choice, better outcomes for offenders, new alliances built that potentially could provide joined-up services, new thinking brought into the field. So there are a number of advantages to be had in opening up the discourse and bringing in people who might have expertise in other areas but haven't necessarily used those in criminal justice. Well, the disadvantage is that these reforms are essentially process-driven, and that means that they have to take out a lot of money from the system, so they're saving money in a system that's quite tight already. Not only are they saving money, but the mechanism of payment is new and relatively untested. So those two things, changing both the provider and changing the process and the way in which the provider is paid, are dangers. And then additionally, it's introducing, particularly for low-risk offenders, a much-needed mentoring service without too much clarity as to what mentoring actually means and the distinction between mentoring and supervision, the potential for that to lead to breach, to drive up the prison numbers, and so on. So it's a reform that comes with some health warnings. Well, the biggest risk that we see is a fragmentation of services, and that's partly to do with the fact that the case management model hasn't particularly been articulated by anyone. So the system looks like it's going to be, what's tier 1, tier 2 and tier 3, and probably lots of different subcontracted arrangements within those tiers. But how that all joins up and who's responsible for joining it up isn't at all clear. And by and large, we're talking about people whose experience of systems is that they're not particularly joined up, who don't have the usual consumer power to make choices of who provides their services or not. So there's a real danger of that the fragmentation makes the system less accessible, more difficult to understand, and that people simply give up, and the people you will be giving up are offenders, and that will increase both the chances of them being rehabilitated, but it will also increase public risk. It potentially is a real opportunity to do more work, but it needs to be work which is not only properly funded. Funding is, of course, a really important bit of it, but it needs to make sense at a local level, and that is quite a difficult thing to sort out at the moment. So if you're a local voluntary sector organisation, you've got local commissioners and health, you've got local provision and education, and suddenly you've got this big contract package area of a tier 1 provider for probation services. So there's a potential to do more work. How you do more work to join up the funding to make sure you get into the client group you want to get to isn't necessarily clear. And what we really need to avoid in this is just local voluntary sector organisations having to provide services on a spot purchase type basis, which isn't going to do anyone any good, really. Well, the hope would be that rehabilitation has worked, and we have faith in it as a concept, rather than risk management. And there's an important distinction between having people reintegrated into our society, then managed safely on the edges. You obviously need both those things, but rehabilitation is what we would want. That the evidence base about what is done is solid, and that what needs to be done has a reasonable and sensible payment mechanism behind it. And if this really works, what we want is communities who are very engaged in rehabilitation, not only in terms of delivering services, but who also see that people can be rehabilitated, and that communities are better off by rehabilitating people rather than ostracizing those. So yes, there's optimism for 2020.